here with Dr. Kathleen Waldorf at the Waldorf Center, and we're talking about some of the advancements in this kind of aesthetic medicine. You know, you start with, on one end of the scale, Botox, and on the other end of the scale, you have plastic surgery. I'd like to spend some time with lasers because it's such new technology for many people, and they hear laser and think, oh, that's going to hurt and that's going to burn, and set this record straight on what kind of lasers you have available and what things you're using them for today.
Really, lasers run the gamut, and what varies is the wavelength and how deeply they penetrate the skin and really what their target is. I think in terms of probably the most common on the market these days is laser hair removal, and it's been hugely successful in the sense that it ablates hair, it really diminishes the amount of hair in a given area, much more so than previous technologies such as electrolysis. So, and that's really caught on, I think with both men and women. When we start to move forward, you can look into, various resurfacing options for the face. There's treatment of redness, brown spots, as well as wrinkles and scarring. I think it's a bit of a misconception to think that lasers can truly tighten the skin. I think we get a bit maybe, but I think it really just the resurfacing and the retexturing of the skin can be much more youthful appearance for people.
But for true tightening and for lasting results, people are going to have to think about plastic surgery, a facelift.
I think it's important to understand the differences of what lasers can do, what non-surgical options such as Botox fillers can do, and what surgery can do, and make the decision that's right for you.
Mm-hmm.
As far as surgery, I think facelifting has come a long way. I think really what we're doing is restoring somebody to a more youthful them, not somebody they've never been.
Right.
It's not the pulled look. It's really a more youthful look to their face, and hopefully one that will last many, many years. I think a person who has a facelift today should still look better in 10 years than if they never had it done. They should never have to do it again based on the fact that things are pulled in the wrong direction.
Right.
If things are put back where they belong, they're going to age gracefully and beautifully.
So one of the concerns that people have is, you see it when plastic surgery goes badly. Is that because people are asking for too much? They're asking, I want this to last, I want this really tight, and it's part of what the patient is demanding?
I think to some degree it may be patient-driven. I think sometimes it's just poor technique or really not respecting, again, the direction of aging and putting things back where they belong rather than in the place they've never been.
Dr. Kathleen Waldorf at the Waldorf Center.